Hey Reluctant Preppers, this is showing you just how easy it is to purchase silver without paying any premium over spot price. You just go to sdbullion.com/rp, scroll down and enter the special code to get silver without any premium, and they'll mail it to your mailbox, discreetly packaged. Inside you'll find a beautiful 10-ounce bar of fine silver, and you are able to purchase that and have it and add it to your stack and your collection without paying any premium. And you're supporting Reluctant Preppers along the way. Thanks.
As a responsible person with growing concerns for your privacy and personal liberty, you want to know where we're headed and what you can do about it. We ask the experts what you need to do to take prudent and responsible action to safeguard your family's wealth and well-being, and what basic first steps will help you to be aware and prepared. ReluctantPreppers.com.
Welcome back, Reluctant Preppers. We are back with our off-grid doctor, J. Nielsen MD. He has a survival compound in Haiti capable of supporting dozens of families. He's here talking with us again on Reluctant Preppers about the things you're not going to typically hear from conventional medical sources, but that you need to know for the good of yourself and your families. Especially good to know when it's in times to come difficult to predict how accessible medical systems will be, but even for today, to make sure that you're getting the care you need and the options you need to stay healthy. Dr. Nielsen, thank you for joining us again here on Reluctant Preppers.
Thank you. I've been tickled the last couple of weeks at how many people are going back and watching the old stuff.
That's good.
I'm getting emails about the prepping stuff that I haven't seen since we did it 4 years ago.
For those of you who have missed it, we've got earlier episodes talking about such things as what to make sure you have in your survival medical kit, how to keep your survival food stockpile healthy so that it is not poisoning your family, and a number of other issues, things you're not finding out about from the medical system. And we've got several more topics on this current series with Dr. Nielsen, but the intention of our channel originally was not so much breaking news as it was valuable reference information that you're just not getting other places.
Right.
So this is great that people are rediscovering some of those gems that are put back there from our earlier conversations. You and I were talking about how we've been focusing on some fairly sort of physiological and biochemical concerns in our last talks, but maybe we want to shift it to something that's more experiential and person-centered. If you could talk to us tonight a little bit about pain and what is going on with, well, we certainly know in the area that we're currently sitting in right now, which is northwestern Ohio, both near Toledo and Detroit, is an epicenter of opioid epidemic and concerns about overuse and abuse of
That's absolutely
opioids. Right. And that's one facet of the pain phenomenon of what's going on. But if you could walk us through, what are some of the key things that people need to know about pain? Is it really on the increase? Is it necessary that it be? Are these things that we're self-inflicted by other things we're doing in our self-care and so on?
That's where I want to go.
Help us understand.
I go back to the basic concept here that, and what worries me is, I've got previously 20 years ago a grade 3 left knee, a grade 2 right knee. My right biceps is missing. I got a rotator cuff. I've got C3-4 and C5-6-7 herniated disc. I got an L4-5 herniated disc. Doesn't make me much of a prepper, okay? The last thing I want to do is get in a situation where I don't have management skills for pain. And we're all trained, well, we'll just run down to the local hospital and replace all our joints. I do not want to be taking an artificial joint into an environment where, 1, I have to work, 2, I have to get on my knees, and 3, I have to worry about getting infections my artificial metal joints.
Yeah.
Our primary objective should be, when we're talking about orthopedics, to go, how do I back the truck up? How do I take 67-year-old or 55-year-old or 32-year-old, and I wish I hadn't done that, joint injury, and can I back that up 10, 15 years and lock it in place? Okay, that is one of our logical questions, and I want to talk about joint preservation and repair.
Okay.
Then the second thing I want to talk about is that it is so easy to let an orthopedic surgeon start owning your joint. You know, the things he can do that dig you into a hole that now you're dependent on this. And more than anybody on earth, I don't ever want to be in that mode. I've worked real hard for the last 20 years, and I'm in better orthopedic shape today than I was 20 years ago.
That's
joint by joint.
Very encouraging. And 2 points. One is a little bit on the humorous side. You made me think right away when you talked about all these various parts of the body. If people haven't seen the movie The Electric Cowboy starring Robert Redford from the early 80s,
Right.
Not that great of a movie, but there's one line in there that came back to mind. He decides he's going to ditch it all and head away from this exploitive world that he's worked himself into in Las Vegas or whatever. And he was an ex-rodeo cowboy. Basically, every joint in his body had been replaced.
Destroyed. Right.
And he's out there finally. He's running away from it all. He's out living off the land, and he's bunking under the stars. And this gal, this reporter lady or whatever, is chasing him out there. And they get up in the morning after having lived on a bedroll underneath the stars in the cold and everything, and he can hardly move. He's just creeping like a cockroach in the morning. She says, "What is the matter with you?" And he said, "Well, I've had so many parts replaced, they don't all wake up at the same time."
That's right. That's exactly right. And you don't want to be there.
Yeah, and the other thing...
Because you've got to feed yourself, and you've got to maintain water, and you've got to be secure, and you've got to be able to walk a line. You've got to be able to do your job. And the person who can't do that is not an asset. And you want to be an asset.
Made me think of was when I was consulting with a doctor about a crooked toe problem I've got, and he was saying, well, here's what we could do surgically, here's what we could do surgically. And I'm thinking to myself, I'm a 45-minute appointment on his calendar today, but whatever we agree to here, I got to live with the rest of my life. I'm the one who walks away with it. I've got to live with it. And that's, I think, one of the points you're making.
And let's look at how that, if you walk in to the standard orthopedic surgeon, what are we looking at? 6-7 minute visit? You walk in, you say, my left knee hurts. Does he examine your right knee? No. Does he look at your ankles, check your leg length, do a standing AP pelvis to see if you have a short limb, rule out radiating pain from your back, do any evaluation of whether or not your sacroiliac is out of alignment? Doesn't even believe in that. Okay? His entire purpose of his visit is to make you like him so that he gets you enrolled in the someday replacement club. And what's the first thing he's going to do to make you feel better? He's going to put cortisone in that joint. And you're going to go, oh, that was really good for about 6 weeks. And then it'll be worse. So what do? You go back and you get more cortisone. What is he doing? Cortisone destroys tissue. It stops repair. That's why it causes osteoporosis. It thins cartilage. Epidurals increase your risk of future disc herniation. Cortisone always destroys. If you're not treating a bursitis, which is the only place that I ever use steroids, you should never, ever allow cortisone in anything if you can help it without a lot of questions, because it's high profit, easy procedure, requires no particular skill, reimburses really well, and sets you up for failure, so you get owned by your orthopedic surgeon. See it every day. And a lot of times you got cortisone in one joint, it made all your joints feel better. You don't even know if the reason you feel better is because you hit the right joint. He could have made your left knee better if he hit your right knee. Cortisone is a broadly effective product. It's going to cause osteoporosis, depression, irritability, rebound pain, joint destruction, diabetes, high blood pressure. It's terrible. And so we have so many things that we're doing in traditional medicine. Probably the biggest destroyer in orthopedics today is Cipro and Levaquin, the quinolone antibiotics. This week I've seen 2 torn tendons from people who had a tendon let go before they got to the end of 10 days of Cipro or Levaquin. Nobody should ever take that antibiotic. You should be dying. Your doctor should be looking at you and going, I've been through all of my other 13 choices, and I've decided I have to risk destroying all of your tendons in order to have this drug. If they don't have that conversation, they don't know that this drug destroys tendons, even though probably about 20% of my practice right now is trying to fix people that a quinolone antibiotic destroyed. It's crazy. And so let's drop back. Let's go back and go, okay, I'm always best off using me because I'm all messed up and I have repaired myself. Why am I messed up? Because I was a runner. because I was a competitive gymnast. The dumbest thing you can do in the world is run as fast as you can, do a handstand, flip over so your body ends up 12 feet in the air, and then land with your back in an arch, the classic gymnast.
But you get good points for that.
You get good points and you lose L4-5S1, which I did. 44% of all competitive gymnasts have L5S1 or L4, L5 spondylolisthesis and broke the two struts in their back. That's terrible. Meanwhile, my knees and my ankles were shot from running for conditioning. And then I shot bow, and a guy gave me a bow that was 20 pounds more than I could pull, and I gave myself bicipital tendonitis. You know, we are the generation, starting with me at 67 years of age, down to the people who are about 35 right now. We're all going to be in wheelchairs with artificial joints 20 years ahead of our parents. I mean, they didn't go out and run around till their knees and ankles were destroyed. They just worked. You know, the best exercise in the world, and it's still true for me to this day, is labor. You know, you let me go out and spend a half an hour moving a wood pile and 30 minutes digging a ditch and 30 minutes the next day loading things into my shipping container, and that won't hurt me the way that if I went over to my exercise machine, got myself right in the perfect position and did the same thing over and over again so I wear a nice groove in my joint. Okay? Well, our body is designed to work. It's not designed to stay in shape for body beautiful time.
Right.
That stuff is destroying us. And so now, let's assume that every listener out there is as dumb or dumber than me, okay? And that they've done that just like I did, okay? And so what can we do now to back that truck up? What can we do to get those joints to go back on? And I call that triple threat. And when I write a macro, it comes up ideal joint repair. And it's 3 products. And I have now had, depending on which product we're talking about, as much as 40 years experience with them. 1, cheapest investment in the world, glucosamine sulfate.
Okay.
Everybody goes, oh, I got to put in a lot of chondroitin and bromelain and all that stuff. I go, no, you don't want to do that. Because what happens is you drive the price up and then you take less. And all the research out of Europe is comprehensive, 3,000 milligrams a day.
Yeah, that's more than a typical dose in the
No, they're all dosed for 1,500.
Yeah.
And they don't work. As a result, they fail. I have people come in all the time and they've been taking 1,500 milligrams for 2 years and they say it don't work. And I go, double it. And 2 weeks later, they go, I'm so much better. It's 3,000 milligrams and it takes 45 days to work. Period. You can't gobble 3 of them and say, I'm okay. Okay?
It's like cooking a Thanksgiving turkey in an hour.
It isn't like Tylenol here. You're rebuilding cartilage. Okay?
Right.
And if people are out there doing exercise that is making their joints hurt at the end of that exercise, or hurt when they lay in bed, or hurt when they rise out of a chair, that's a minimum, $22 a month. But here's the problem, okay? 86% of all of the glucosamine sold in the United States is made in China. And it's all coming out of the Yellow River, which is yellow for a reason, okay? It's all full of mercury, arsenic, and lead. You need to know your source material. You need to be getting stuff that's coming out of crabs from Nova Scotia or Jamaica or Puget Sound. The people who are making it in those environments are making tested, clean products. I buy my glucosamine at a quality price point from a company called DC, and I've used it for years, and it's clean. I've tested it myself. It's clean as a whistle and meets the criteria. It's not expensive. So that's number 1. Number 2 is a product that I actually had the pleasure of meeting the inventor, and it's called 1222 Natural Relief. And the reason that it's called that is it took them 1,222 tries to figure it out in 20 years of research. And what it is it's shark liver oil with homeopathics. And we all know sharks make interesting stuff. Their cartilage does other things. Well, as it turns out, unlike fish oil, okay, this is a very special form of arachidonic acid. And the essential fatty acids that are in this product actually stimulate ligaments and tendons and cartilage to grow and heal. And it is the only topical product I've ever seen that relieves pain because it causes healing. And you can't put it on enough. When I am going to go out in my backyard, move my wood, and go load my shipping container, I will put it on both my knees and both my shoulders and the back of my neck. I always tell people that if you can't feel the bone under your skin, it's probably not going to work as well. It's trying to get to articular cartilage and surrounding joint ligament. That product came out 20 years ago. Everybody in my practice lives on it, goes, oh my gosh. Between glucosamine and 1222, I managed to brilliantly wipe out about 3/4 of my injection practice. People just didn't need to inject it anymore. Brilliant. What a great business plan.
You're putting yourself out of business.
Put myself out of business, okay? But I like the small victories. They're fun, okay? And then 3 years ago, I really hurt myself with a product by Designs for Health called Arthroben. Arthroben.
That one you mentioned earlier.
Yep. Got to be careful. They make it with stevia. That's how I got my PSA up to 40 and gave myself all those problems. Okay, but it comes unflavored. Don't ever buy the apple stuff. Get the unflavored stuff. The first time you buy it, it only lasts 3 weeks. You take a tablespoon and a half twice a day for a week, then a tablespoon and a half once a day until the bottle's empty. And if at the end of that, you have my experience, which is the next morning, my pain was gone. This stuff was incredible. This is the peptide that people with osteoarthritis can't make. So you're artificially putting in the peptide that tells the 1222 and the glucosamine to make hyaluronic acid in your joint. And I did Synvisc injections on my knees from the day that stuff was invented until Arthroben came out, and now I don't need them anymore. Once this stuff works, I tell people, if it doesn't work, then you don't have that peptide deficiency and this is not your product. But if this stuff relieves pain and makes you more functional, you drop to a level teaspoon, and now the next bottle will last 6-8 months, and it's not expensive. And you put those 3 things together. I just did Platelet-Rich Plasma on the guy who just walked out of here an hour ago, 30 minutes ago, and I put him on all 3 of them. Usually what I do, but he was in a hurry, is I tell people, get on my triple threat and call me in 4 weeks and tell me if you still need my platelet-rich plasma injections. Almost 50% of my patients end up not needing injected with supplements.
Just compare at a very high level for our viewers what kind of cost per month or something that kind of a regimen would settle down to versus the injection.
Glucosamine is 120 capsules, 40 days for $22.
That's about 18 bucks a month.
15. The 1222, I probably buy one twice a year, and it's 40, so it's about $7 a month.
So we're up to 25. Huh?
Yeah, and Arthroben, once I get past the front load, if it works, is 60 and lasts about 6 months.
That's 10 more, so it's a $35 a month total to do that whole regimen on a sustained basis.
And most people are spending that much on Nsaids. So let's talk about Nsaids, okay?
And just to be clear for everyone, we're talking about is non-steroidal
anti-inflammatory drugs,
such as
every Motrin, naproxen, every prescription, every anti-inflammatory, but not Tylenol.
Advil, aspirin.
Advil, yep, aspirin.
Nuprin.
Yep, okay. And all the prescription ones, Voltaren, Ketorolac, all of them. They're all the same. I was in practice briefly with a cardiologist who specialized in nutritional medicine, and when Vioxx and Celebrex came out, he stood up one night in a lecture and kind of like Babe Ruth pointing up into the bleachers said, I predict that in 7 years these drugs will be all pulled off the market for causing coronary artery disease. Their biochemistry is going to cause heart disease and atherosclerosis. And I thought, man, that's pointing into the decks. 7 years later, Vioxx got pulled off the market, and Celebrex bribed enough people at the FDA to stay on the market. Immediately, Europe and the EU went out and studied all the non-steroidals. And which drug, out of all the non-steroidals, which one causes the most heart disease? Ibuprofen, Motrin. And they haven't told you. because it's over the counter and they don't know how to bring that back. They don't know how to go, we decided this drug's so safe that we'll let people kill their livers and their kidneys and their hearts with it over the counter. And now here we are, and they're not telling anybody. And now we just saw studies that were published 6 weeks ago showing that it increases your risk of coronary artery disease. 1 week later, you double your risk of heart attack from taking one Motrin. For the next 7 days, you've doubled your risk of heart attack, increased atrial fibrillation. These things are so cardiotoxic. I don't care about that. What I care about is the fact that they work because they stop healing. They completely shut down joint repair. The American Association of Arthritis Specialists, AAA, something S, published a study in 1979 in which they took people with osteoarthritis, gave half of them a non-steroidal anti-inflammatory and half of them Tylenol, and followed them for 10 years. And the rate at which joint replacement occurred was 7 years instead of 10 years. 1/3 faster when you use non-steroidals. And their conclusion of the author was no one should be taking these drugs. Don't worry about the heart and the AFib and the ulcers and all of that stuff. Yeah. The liver and all of that stuff. You shouldn't be taking them because they're accelerating your arthritis. The only way you should take a non-steroidal is because you've really hurt yourself and you can tell that you're going to go down. And you should take one 800 milligram Motrin or 550 naproxen or whatever one time and stop that process. And then go, oh, that's it, I'm not doing that again. I probably take 6 Motrin a year. Because I have times when the night I came back from packing my last container, I couldn't get up the 2 steps into my house. That was definitely a Motrin moment. Okay, and I would take that Motrin with Tylenol so that I get further cast on it and get pain relief that doesn't make me go back to the Motrin, and instead I'm ready to make my Tylenol work. Okay, and so, you know, this whole concept of don't do cortisone, don't do anti-inflammatories, rebuild your articular surface. Why is it all happening? It's all happening because we're doubling down on stupid. You know, we're doing, the list of dumb things I've done in my life is just absolutely magnificent, and I'm typical, okay? And I look back and I've got like 10 moments in my life I'd really like to have back. And that 1 minute after,
to redeem that mistake, you mean?
Yeah, and go, well, I definitely shouldn't have jumped off the roof of that dump truck. That definitely took my left knee out. Okay, my left knee, yeah, sure, the gymnastics and the running did it, but jumping 11 feet off that dump truck roof, a bad idea. And so you need to really go, when you climb up a ladder, climb down. When you're down to 2 steps from the ground, there's still another step to go. Don't jump. It's, you know, we're taking ourselves in the air, but then we somehow think that, gee, gravity's my friend. No, it isn't. It's not your friend. Don't impact your joints. Don't lock your joints and land from a height. You know, always come down the way you went up, and don't hurt yourself. And if you look at something and go, I shouldn't lift that, don't lift it. The fact that your brother-in-law didn't show up to help you means it should stay in the truck until somebody comes. You know, oh my gosh, the things my wife and I in our extreme age have loaded into shipping containers because nobody came to help us load that container are just laughable. And we just go, we shouldn't do this. And I go, this shipping container's leaving at 8 o'clock tomorrow morning and nobody's here. So you pick one end and let's lift well and, you know, let's put our belts on and do that stuff. Well, you shouldn't do that. You know, you should be smart and not do that stuff. I just did platelet-rich plasma about 5 months ago on a girl who was in a spinning class. You know what spinning is? As best that I understand it, you put a bunch of people in a circle so they can see each other, okay? The Peloton concept, okay? And then you sit there and row and pump your arms on some kind of machine designed to symmetrically destroy all your joints as hard and as fast as you can without any rest until you collapse. And the person who collapses last is called the winner. I may have this wrong because I've never seen it, but I've heard it described, and it's some kind of a competitive joint destruction exercise. Okay? And she comes into me, and she is absolutely body beautiful. She is buff. She looks great. And her MRI in her right arm, she has worn through all of the cartilage all the way to the bone in her elbow, the most complex joint in the human body. And the MRI comes back, and it made me cry. I just went, here is Body Beautiful is now not going to be able to pick her nose. And she couldn't. She couldn't get her hand to her face. And she said, you know, what can you do? And I said, have you been to the orthopedist? And she said, yeah, they want to fuse it. And I said, yeah, I'll bet they do, because that'll stop the pain. Where do you want it? Do you want to fuse it here, and then you can't get to the plate, or do you want to fuse it there and you can't get to your face? What do you know, and an elbow that's fused is, where is it? It's nowhere. It's of no use, you know. Go for whatever lets you wipe your butt. I guess that's the bottom line, right? And so she said, have you got anything? And I said, well, I'm going to be honest. If I fix you, you're going to go right back to spinning and destroy it. And I said, what I have won't work twice. Okay? And she sat there, and she could tell I had her, right? That I'd nailed her. And she said, you're serious? And I said, yeah, you won't get two tries at this. If what I want to do works, and I don't think it will work, but I think we should try it, you only get one try. She said, okay, I'm listening. So we put her on triple threat. We waited 4 weeks. I brought her into my office. I drew, 100 cc's of blood out of her arm. I put it in my centrifuge, spun it for platelet-rich plasma, separated out my layer, and sat down with my fluoroscope and very carefully injected every joint in her elbow and every ligament and tendon, and said, I hope it helps. And her husband came in to have both of his rotator cuffs done last week, and I have not seen. 2 months later, she was much better. And I said, is she exercising? He said, no, she's swimming, like you said. And the true correct exercise, no weight bearing while you grind a joint, right? And he said, it's amazing. Every day she's better.
Oh, wow.
And I went, I can't believe it. But, it's such a wonderful tool to be able to take your blood out of your body and spin 100 cc's of blood down until you get 6 cc's of growth factors. Now, you got to be on that triple threat. Got to be on the glucosamine, the 12-22, and the arthrobin. You got to have the ingredients, because the growth factors are simply, being told, go together and act, and stimulating it, really stimulating it. And to be able to do that and inject this stuff into ligaments and tendons and inject it inside joints, and there's so many places where this is being used. It's changed burn units in the United States. I understand what they're doing now with these kids that used to spend months in a burn unit with a 70% third-degree burn. They take them into surgery on the third day. They put a needle into both their anterior tibias, which is a real nice way to get a lot of high-quality blood and bone marrow out. And they hook them up to like a dialysis machine or a coronary bypass kind of machine that's instead designed to remove the growth factors, the platelet-rich plasma, and put all the blood back. And they take all the growth factors out of these kids. And then once they have it collected, they are still asleep, and they strip off all their burnt skin, pat everything till it doesn't bleed, and then they put it in one of those hobby guns that sprays, and they spray this stuff all over all their burns, and 3 days later all their skin grows back normal and they go home. It's changed burn units, I understand. What a wonderful thing. Is your orthopedic surgeon telling you about that? I charge $500 for platelet-rich plasma. Most people charge $2,000, $2,500, but I charge $500. And my attitude is, I get to do it every day. And if I go to $2,500, I get to do it about once every 2 months, and I won't be any good at it. And when I do it every day, I'm really good at it. And so I don't charge much. But even at $2,500, what a bargain to be able to do that. And is the orthopedic surgeon telling you that? No, because he doesn't want to lose his $60,000 hip replacement or his
Okay, I was going to ask you, what's the
joint
other angle
replacement.
then?
He's a surgeon. He doesn't want to do anything with a needle except pour cortisone in you to make you break down faster, so you need a joint replacement. He doesn't want you to. He tells you, oh, glucosamine doesn't work. Orthopedic surgeons have done studies on 1,000 milligrams. But they'll never give the right amount for the right amount of time, because all the European studies have shown, oh my gosh, it just delays joint replacement for a decade if you take it. And so, you look at all, and then people come in and they say, well, what about stem cells? And I go, I'm fully trained in stem cells. You know, I went and did the training 8 years ago when they invented it and was one more of my tools. But it's a lot of toys and a lot of equipment. It's $10,000. And I go, really? You know, I did stem cells for a while and I did platelet-rich plasma twice and it was as effective as stem cells once. And I go, $1,000, $10,000? You know, why do stem cells? Now, the stem cell thing where you've got Parkinson's and you go down to the Dominican or down to Mexico and you have one of those real high-end centers, you know, go in and do the liposuction and take everything out and then put it in a catheter and inject it into your heart after a heart attack immediately. Or that study was amazing. I don't know the guy who did it. Or, you know, they put it intra-arterial into your brain for Parkinson's. I got a guy who's Parkinson's went away in 30 days. You know, I'll go do stem cells when I get some chronic degenerative disorder that makes sense. But those people are spending $20,000, $30,000. Better be rich. PRP can't do that. PRP is an orthopedic tool and a hair growth tool. You can make your hair grow back. It's the bloodiest, most painful thing I ever saw. I did it once, said I'll never do it again. And a burn tool, cutaneous tool, but basically it's an orthopedic tool.
Other forms of pain, sources of pain that are more and more common these days that you're seeing people report that you think have potential solutions that people aren't being presented with?
Well, back to our entire discussion of Lyme disease. I mean, we got an estimated 40 million people in America who have Lyme neuritis and arthritis, and their management is to be correctly diagnosed and treated. We've got an entire generation my age, exactly my age, who have a mouthful of silver fillings and neuropathy from mercury fillings, and they think they removed their fillings and somehow that removed the mercury from their body. No. You know, those people need chelated. First, they need correctly diagnosed, and most of the people who are doing that, I don't believe in their testing techniques. I use a guy in Lambertville, Michigan, who does hair analysis, and he's the best I've been able to
We
find.
wanted to have that on in the future to talk about mineral analysis and the effect
Jack
on
would
health.
be brilliant.
Okay,
Yes.
we'll plan on that in a future episode.
Yeah. And so, you know, you've got all of that. Diabetics have peripheral neuropathy, right? In Europe, the management of diabetic peripheral neuropathy is large doses of evening primrose oil. Gamma-linoleic acid is made from alpha-linoleic acid, and blood sugar above 140 stops 2,5-delta desaturase from making that conversion. And so this is an essential fat deficiency. And if you take massive doses, evening primrose oil comes in 1,300 milligram capsules. If you take 8 capsules a day for 30 days, and your diabetic neuropathy improves, keep going. And you can cure your diabetic neuropathy. I just saw a study 2 years ago at the American Association of Orthopedic Medicine, and this guy is taking platelet-rich plasma and an ultrasound and injecting platelet-rich plasma along the nerves in the legs, and the diabetic neuropathy is going away. Yeah. People who have peripheral neuropathy of unknown cause are frequently traumatic. I have a friend who was standing at a big fireworks display, and instead of going up, it exploded, and she got a concussive injury to her feet. And she had been in a workers' comp claim for years, and her pain wasn't any better, and I told her to go out to a local guy in the community, and he takes an ultrasound, and he finds the fine nerves, and he puts a real fine needle in with saline, and he injects between the nerve and the sheath and expands the sheath, and she got off the table and all her pain was gone in an hour with nothing but saline, nothing but salt water. Okay? These are the things you learn when you go to integrative physicians who are not trying to do joint replacement. And everybody goes to their family doc who gives them a non-steroidal, and when that's over, they order an MRI without doing any plain x-rays, which are actually more accurate for joint evaluation, and then they get sent to the orthopedic surgeon and they get operated on. And they never go ask anybody who knows any biochemistry, how do I get out of this? I have an entire 50-pound case of glucosamine in Haiti waiting for me. And I'm sure it's out of date, and I don't care. Yeah, I'm glad I own it.
Hey, how
I want
about
a lifetime supply.
people who have already had a joint replacement, or they have a loved one who has had a joint replacement? What can they still do to either help forestall or prevent infection or rejection or the other joint that's not been replaced of going the same way?
I was going to say, everybody has a joint replaced and then sits around and does nothing for the other joint that's 30% behind it. It happens to me all the time. They come in and I go, God, I can't believe it. You went and had the other one and you never talked to me, you know? And so the first thing is don't give up. You got one joint replacement, don't go for 9. As far as it goes for not getting infected, stay out of hospitals. That's where all the bad bugs are. In my community, probably 5% of everybody who gets a near hip replacement comes out with MRSA infection and has to have all the metal taken out and sits in a wheelchair for 6 months and can't walk and then goes back and has a PICC line in and 3 antibiotics IV for 90 days and, you know, the whole thing. And I go, man, I don't know how to I know what hospitals I'd go to, but I don't know how to tell the public, you know, I don't know if you can go online and find out what the infection rates are in your hospital, but I don't know if I'd believe them anyway. But, you know, the hospitals are a great place to pick up superbugs. Never, ever, ever, you know, go in a hospital if you can help it. They talk about, take an antibiotic because you're getting your teeth cleaned. We did studies on picking your teeth in the dentist's office using a water pick and brushing your teeth, and water pick was the safest. Brushing your teeth was equal to going to the dentist. So are we going to take antibiotics every day, or are we going to quit brushing our teeth? None of those things have ever really been proven. That's a theory. Nobody's ever proven that dental bacteria go to joints. That's a guess. There's no good research on that. And there are some people now who are going, this is really bad because all these excess antibiotics are, 1, going to our water supply, and 2, destroying your gut flora. And so, you know, I tell people I wouldn't buy that model. I probably once every 6-8 weeks in my practice have somebody who comes in and their secondary complaint to me is dental loosening and chronic gingivitis. And I go, are you using a water pick? And they go, no, my dentist told me they don't work. And I go, oh, you bought the model. Let's keep him sick model. I said, go buy one and prove him wrong. And they come back in at our next visit, and they're supposed to be there about their knee or something, and all they want to talk about is their teeth. And I go, God, I can't believe it. In 3 or 4 days, I was better. Okay? It is the greatest tool in the world. That new ad they're doing where the water pick cleans the corn is the best thing I've seen. Waterpick has finally figured out how to advertise, and I would never, ever not have. And again, I got a Waterpick in Haiti.
What do you tell people who suffer from chronic headaches, sinus headaches, migraines? Can we deal with that? Because that's, I think, a common complaint of people I meet.
Most migraine patients are of 3 or 4 mechanisms. 1, their magnesium is potentially low. 2, they're estrogen dominant. If they're a man, their testosterone may be turning to estrogen. If they're a woman, they're drinking bottled water and getting their styrene up, but not their progesterone, and they need progesterone. I see. Yeah, there we go. This week we're not on plastic.
Learned my lesson.
Yeah, learned your lesson. And so knowing your hormones is an issue. One of the issues is food allergies. Those people usually know it. They know I eat tomatoes and I get migraines. But the vast majority of my patients are a combination of cervical misalignment, TMJ, and lower cervical disc disease. And you need to go to a chiropractor who doesn't do the everybody take a deep breath and we'll both scream while I crack your neck. That stuff is going to destroy your neck. You want to go to either an activator guy or better yet, a kinesiology positional guy. And one of the things we were talking about, and I want to throw it in really quickly, is what about my L4-5 disc and my C3-4 and C5-6-7 discs when I go to Haiti? And the answer is I have a Saunders home cervical traction unit and a teeter inversion.
Yep. We have both of those at our house too.
Yeah, and I am in Haiti. And because I got a whole bunch of people down there, and we're all old, and we all have bad spines. And, you know, sometimes I can't get on the darn thing at the end of the day. Some of the people who are working in medical clinic or on my construction teams are coming back at night at supper, and I need to get them in therapy. And it works great. And you're looking at $300 for the Saunders home traction unit cervical, and $280 for the teeter. It's best in the world.
Yeah,
Don't get anybody a
Costco
teeter.
sells those too, yeah.
But Costco doesn't give you a 30 days for $15 return it free.
Okay.
I tell people, I've got people who say I'll get it at Costco, and I go, they don't give you the guarantee. And the company, direct from the company, does. They ship it back at their cost. They're good at their word. I've got hundreds of patients who own teeters. And so you really always, when you're having headaches, you want to get neck films, and you want to ask your dentist to evaluate your TMJ and make sure you don't have a tooth that needs re-leveled. And of course, I fix TMJ with PRP. One injection, it's gone. And so you really want to think orthopedics and spinal pathology for headaches. We've kind of gone to this migraines need a seizure drug and then Botox. I go, neither one of those are addressing why you have a headache. Sinuses, love it. You can buy these things over the counter. Greatest machine in the world. It's called a NasoNeb, Nasoneb, okay? And if you can't find it on the web, talk to your custom compounding pharmacist, and he's always going to have one. And those guys know how to put things in the solution other than saline. Everybody puts in normal saline. Kick that up 50%. If it says 2 packages, make it 3. Get to 1.35%. So much more effective. This is a nebulizer that is like the Learjet of neti pots. A neti pot really just drowns the bottom of your nose and makes you choke to death. It never goes any place you want unless you do the neti pot upside down. You can hang by your ankles and do a neti pot. That's really great, but you'll think you died. This thing is nebulizing solution up into your turbinates and up into all your sinuses and cleaning out, old debris. And I have not, since that machine came out, I have not had a single person in my practice have sinus surgery. This will put the ENT people and the ventilating tube people and the functional endoscopic sinus people out of business if people get involved in NasoNebs. They're wonderful.
I know you've talked about ice crowns or other ways of...
Oh, I love ice rings. For people who get acute headaches, what you want to do is take a big Turkish towel, roll it up tight, sew the edge of it so that it can't unroll, and then put it around your head and figure out what a not loose, not tight fit is, that it'll stay in place, and sew it together end to end. Make a couple of them, dip them in water, squeeze them out to the point where they won't drip, set them in the freezer, and then after they're frozen, slide them into a Ziploc because the water will come out of them over time, and seal them up. And when you get a headache, pull them down over your head above your ears. And I have people who go, nothing has ever stopped my headache faster than an ice ring. We have the Diamond Headache Clinic in Chicago is the best in the world at figuring out complex headaches. And if you asked Dr. Diamond until he died, his biggest trick, he'd go, ice rings. He all love them. He says, can't get patients to do them. They all want drugs. He says ice rings are the greatest thing in the world. I had a guy who came in one day, new patient, and he's sitting there squinting. And I said, you have a headache? And he says, I'm just getting into a migraine, and man, it's going to be a doozy. Well, I said, just a second. I went out to my refrigerator and grabbed 2 great big ice bags. I didn't have an ice ring. Put one on the back of his neck. Okay, by the way, ice on the back of your neck's what stops nosebleeds, not your face. It's about back here. And put one on the top of his head. And went back to typing on my computer, and I looked up a couple minutes later, and the guy's going, he said, what'd you just do to me? And I said, an ice ring. And he said, I've never experienced this before. And I said, I'll teach you how to do an ice ring. And he just continued to be very steady at it. It's all about the fact that the arteries to the scalp are going through cyclical contraction and expansion that eventually causes scalp edema. And the minute you put that ice ring on and catch all of the arteries going out to the scalp, everything pulls all of the edema out, and all of that goes away instantaneously. That's why it works. Might be a little biofeedback involved too. That cold may be doing something down the biofeedback angle.
Trying to think if there's any major stones we've left unturned. I'm sure that there'll be lots of questions from viewers on specifically. We didn't talk about their kind of pain, whether it was repetitive motion injury or...
That's back to my girl with the elbow doing the same
true.
stupid thing over again. You know, if you're sitting working at a keyboard and you're getting repetitive motion, you need to do things like get the foam rest, get the right chair, get one of those. They now sell a really cheap sit-stand computer thing at Costco that's like half the price of the expensive ones. Really liked it. Looked at it the other day. Lovely device. But the other thing you need to do is go, how do I stop that? I've had three. I destroyed this hand in 1994 in an accident. I've had 3 surgeries on it, and I'm a very fast typist, as you know, very good typist. But I do speech rec and voice recognition. We all have it on our phone. You got a smartphone? Download Dragon Dictation. A lot of times if I'm someplace, I'll open Dragon Dictation, dictate everything that I had in my idea, and I email it to myself. And when I get back, I put it someplace. But, you know, it doesn't take any voice training to do the online Dragon Dictation. I don't know why it's so accurate. But you can buy Dragon with the, with the headset, okay, for $35. And it takes a couple months, and you can use it and say, take me to A3 in Excel. 98.46, you can run your calculator. 98.42 plus, and it'll just sit there and run your calculator. Get your hands in your lap, use your voice, use your brain. And nobody is doing anything to unload the injury. But sometimes I look at people and say, you need a different job. This is not you. You're not the person that should be doing this. People who come into me and they're on a new job, cutting meat, counting pills, doing transcription, and they get carpal tunnel in 8 weeks. I go, you aren't going to make it.
Yeah.
You're going to have your carpal tunnel surgery in 6 months, and then you're going to get carpal tunnel again in 2 years, and the surgery won't work second time. Not that they won't do it, but it won't work. And then you're going to have carpal tunnel for the rest of your life so that you could have a job that paid $2 more than something else. Quit this job and go find, as I always tell people, go get a bait shop job, something where you do a different thing every 10 minutes.
So let's turn, in our last couple of minutes, just turn this whole thing on its head and say, imagine that there's been a major disaster, a major societal breakdown, access to all these specialists we've talked about isn't available anyway, access to half of the drugs we've talked about isn't available anyway. So one thing you've definitely said for common sense joint care is change it up, do functional motion, don't do, if you can avoid it, don't do repetitive, same, because that's not natural. That's not what we were designed to do.
Not what we were designed to do.
Okay, so the other thing...
Don't jump down off of stuff. Don't lift stuff heavier than you can lift.
Right, and then you also mentioned ice as a good alternative.
I'm going to take lots of Tylenol wherever you're going.
Isn't that a liver problem?
Well, it is with alcohol, but not without.
All right.
And especially not if it's intermittent.
Okay.
Yeah, Tylenol's really quite safe until you push it to the top doses and stay on it.
Okay.
And then it takes a while.
Okay, so any other stones we've left unturned for people who are in a off-grid or not with access
well, we
to the
haven't
system
done
care?
abdominal pain, but that's going to come back in one of our nutritional lectures, and we'll pick it up there.
Okay.
We haven't done urinary issues that are painful, but that will come up in a nutritional lecture in the future. We've done a pretty good job of hitting most of the pains.
All right. Well, we have been talking with our off-grid doctor, Dr. J. Nielsen MD. This subject, as you've noticed, has been circling around the topic of pain and pain management in ways that are going to protect and preserve and even restore the health of your body and prolong the health of your joints. Dr. Nielsen, thank you as always for joining us here on Reluctant Preppers.
A lot of fun. I enjoy it. Thanks.